Welcome to my channel. This time we talk about the anatomy of the arm. Arm is the part of the upper limb between shoulder and the elbow. Shoulder and the elbow. So we have a fascia, superficial fascia and deep fascia. The deep fascia divide upper arm into two compartments, anterior compartment and posterior compartment. Anterior compartment have three muscles: Biceps Brachii, Brachialis, and Coracobrachialis. Posterior compartment have triceps only. So we talk about every muscle, function, origin, insertion, blood, and nerve supply. Biceps Brachii have two origin and have two head, long head and short head. Long head, supraglenoid tubercle of the scapula. Short head, coracoid process of the scapula. Coracoid process of the scapula, supraglenoid tubercle of the scapula. Insertion is the radial tuberosity and bicipital aponeurosis. This is radial tuberosity, and this is brachial aponeurosis. We don't see this picture. So all the anterior compartment have one nerve, and it's called musculocutaneous nerve, and blood supply is the muscular branch of the brachial artery. The function, biceps brachii function in elbow is the flexor of the elbow. In foramen is the supination of the foramen. Another muscle is the brachialis. The origin of the brachialis is the distal half of the anterior humerus. This is the distal part of the anterior humerus. And the insertion is the coronoid process and tuberosity of the ulna. And this is the tuberosity of the ulna. So remember, insertion of the biceps brachii is the tuberosity of the radial, and insertion of the brachialis is the tuberosity of the ulna. So nerve supply is the musculocutaneous, and we have exception. Brachialis nerve supply is the musculocutaneous, and a small part come from radial nerve. And blood supply is the brachial artery and radial recurrent artery. So the function is the main flexor of the elbow. The only function is the flexion of the elbow. So another muscle is the Coracobrachialis. Coracobrachialis come from coracoid process of the scapula. And insertion is the middle third of the medial surface of the humerus. So nerve supply is the musculocutaneous, and blood supply is the muscular branch of the brachial artery. And don't forget, the function is the flexor and adductor. And we talk about posterior compartment. Remember, in posterior compartment we have the one muscle, and that muscle is the triceps. Triceps has three head: long head, lateral head, and medial head. And every head comes from origin. The origin of the long head is the inferior glenoid tubercle of the scapula. Remember, biceps brachii come from long head come from supraglenoid, and our long head of triceps come from infraglenoid of the scapula. And lateral head come from posterior humerus above the radial groove. And medial head come from posterior humerus below the radial groove. So insertion is the olecranon process of the ulna. So nerve supply is we are in posterior. The dominant nerve supply of the posterior is the radial nerve. So the nerve supply of this muscle is the radial nerve. And blood supply is the profunda brachia or the deep brachial artery. A function is the extension of elbow and adduction of the shoulder. So don't forget that. You need to remember, when So you need to remember of the nerve supply of the brachialis, because of the nerve supply is the two musculocutaneous, and small part come from radial nerve, and blood supply is the also exceptional brachial artery and radial current artery. You need to memorize it by detail. Bye.